Hello, all. This is Dr. Dheeraj Masapu. I'm a senior consultant in the field of neuroanesthesiology, and today I would like to discuss a topic called as hyperspecialization. So, hyperspecialization means above super specialty. So, why I'm doing this particular video is I am, predicting that the future of healthcare would be hyperspecialization. I'll try to explain you with a scenario. Imagine there is a fitness trainer who started his own gym in his vicinity, and what happened is nobody turned up to the gym and it became a flop. He lost all the investment in that. And then what he did is his wife became pregnant, and after her delivery he started explaining some exercises to her, and looking at that, people are surrounding that area also started to come to him who are in such situation, postpartum people. And then what happened is slowly he started doing YouTube videos on that, trying to educate people in Instagram on how to actually become fit after postpartum. He developed a following. After that, he actually made his own gym only for postpartum people, and he became a super hit in that particular place. So why I told this particular story is, see, rather than projecting yourself as a fitness trainer, if you project yourself as a fitness trainer for postpartum people, that leads to more success in future. And it is possible only in India, because so when you are trying to niche down to such a small areas, it wouldn't work out in a place like UK. Doesn't work out in a place where population is less, because the incidence of disease will come down. But in India, what happened is, we are fortunate that we have 145 to 150 crore people. So even if you niche down, there is high possibility that you will get enough patients to you from across all the states in India. And I'm seeing that in many people in India. It's already happening now, and it will happen more in future. I'm seeing so many doctors who have niched down to one particular area, and overall from different states of India, people are coming to them. And not only that, different countries also, people are coming to them because they have proven themselves in that particular area. And I would tell you, in this particular video, what are the different areas in medicine you can actually hyper specialize, and which will work out. And also, what are the advantages and disadvantages, I would like to tell you. There are some cons of hyper specialization, even that I would like to cover in this particular video. So before that, I would like to show you with live examples. This is come from one of the agency of Saudi Arabia. What they're asking, you see, they're clearly asking people for pediatric endocrinology consultants only, pediatric gastroenterology, pediatric pulmonology, pediatric neurology. So all you guys are thinking about MD pediatrics and starting your OPDs, but that is not the reality in future. In future, what's going to happen is you need to do something above that. Like that, in every area, you need to, there wouldn't be something like pediatrics in future. It will be there in tier 2, tier 3, but in tier 2, tier 3, there are different problems. They'll get saturated in future. So in tier 1, what happens is, since the population is migrating more to tier 1, saturation risk would be lesser. That's a different topic discussion. So you need to actually niche down to one area. You shouldn't be a pediatrician. You should be a pediatric gastro. You should be a pediatric pulmonologist. Something like that you need to focus on in future. Okay, this is an example. Another example I would like to show you. So here they're asking, consultants in breast surgery only. Okay, so breast onco only. So in this way, actually, they're demanding now in Middle Eastern countries. So same thing will start in all the areas. So they wouldn't want one, MCH oncosurgeon. They wouldn't want only MCH oncosurgeon who's only working on breast in future. Something like that would change in future. So right now, we'll dwell into all the possible hyper specializations that one can do in future. Okay, so by hyper specializing in one zone, what happens is you will actually become a brand, and you will gain the trust of the people. And not only that, your opportunities actually increase. You will think that by hyper specializing to one area, your opportunities would come down, but it's a paradox. Your opportunities actually increase by going to one niche area. So what are the niche areas? As I already told you, pediatrics, if you do, that's not enough. You can venture into pediatric gastro, pediatric pulmonology, pediatric endocrinology, pediatric neurology. See, all these hyper specialties, some areas DMs would be there in India. In some areas you have to do fellowships. In some areas you have to go to some countries and come and back, do fellowships, and you have to come back to India. Okay, so I can't cover which countries to go in this particular video, but in future we would be doing all that. Internal medicine, for example, if you are doing, then you can go into general cardiology and electrophysiology. That's a hyper specialty. Or you can go into DM gastro and the neuro gastroenterology, because the inflammatory bowel disease, incidence is increasing, and hepatologists are coming. DM hepatology, they only deal liver. So that kind of specialist would be required in future. And in surgical specialties, if you see after MS general surgery, you can go for endovascular neurosurgery, you can go for oculoplastic surgery. Robotic surgery is becoming a separate area, and robotics wouldn't be one specialty. It will be more like robotics will come in every segment. Urology already robots are there, gastro robots are there, and neuro. Till now, there is no robot which has come for neurosurgery, but for spine, there are robots available. For orthopedic, robots are there. So you have to become a robotic surgeon in that particular subsegment. Okay, and bariatric surgery will flourish in future because a lot of people are binge eating and sedentary life. So if you focus only on bariatric surgery, that would be very beneficial in future. Transplant surgery already I don't have to talk about. It's a proven specialty. And then in orthopedics, you shouldn't project yourself as an orthopedician. After that, you have to hyper specialize in pediatric orthopedics or sports medicine or pediatric orthopedic onco or minimal invasive spine surgery. All these things you can do. So by doing all these things, your chances of success would actually increase. And in surgical onco, already mentioned, breast surgical oncology would be a good option, or hepatopancreaticobiliary surgery. This can be done, in after MCH gastro also. So then cardiothoracic surgery, if you're doing, you can venture into lung transplant surgery. You can only niche in that area, and you might think that the number of cases would be low. That is reality. But what happens is, if you are an expert, maybe all the lung transplants or all the heart transplants, if you are doing, then even if you do 5 to 6 in a month, that would actually be enough for you to earn a fortune. Not only for you, you will build teams. I know there is a team in, I don't want to mention the name of the team, but there is a team in Hyderabad who is doing a very good job in lung transplants. So they do a lot of lung transplants, and that is how it is. When you hyper niche also, you can actually flourish, and not only you, along with you, a full team will flourish. Colorectal surgery is another area, and obstetrics and gynecology. If you're doing OBG, then you try to venture into reproductive endocrinology, infertility, specialities, and gynec oncology is another area which is a very good area to subspecialize in. So what I'm trying to tell is, you need to focus on one area. If you tell that I'll do everything, that is not going to work out in future. And neurology, neurosurgery, epileptology, epilepsy surgeries, and neuroimmunology, functional neurosurgery like deep brain stimulation are coming up. So this is another area you can hyper specialize. And then emergency medicine is not hyper specialized yet, but in future there would be areas like toxicology, disaster medicine, and trauma areas would come in future. Anesthesia is already hyper specialized. Now cardiac anesthesia is there, neuroanesthesia like what I'm doing, pediatric anesthesia, obstetric, gyne, labor analgesia. So many things are coming up in anesthesia. Okay, and then radiology, if you take, you can go into interventional radiology, musculoskeletal radiology, and all those things. And then if you come into the oncology, immuno-oncology, pediatric oncology, and radiation oncology with proton therapy, if you do, that's like hyper specialization. I spoke about this in one of the video. Okay, so the advantages of becoming a hyper specialist is you actually become a brand in your particular niche. So that is very important to position yourself like this in future. And but along with this, you need to do few things. Like you need to develop a digital presence. Okay, that is like you need to have a blog or a website or a platform in YouTube, LinkedIn, or some digital media you need to use to project your work. And also you need to speak in all the conferences and webinars, and you need to collaborate with all the big industry leaders in that particular area. Okay, and you need to invest yourself in a lot of educational activities, because when you're telling the world that you're best in that area, you need to constantly evolve and you have to constantly learn in that particular areas. Patient testimonials and referrals and all these things are secondary. And then there are certain challenges if you hyper niche. See, if you're a generalist, you're more safer. I can understand totally. That is a false sense of security according to me. But the thing is, like, people tell that it's a limited job market. That is, I totally understand, because when I finished my DM in neuroanesthesia, it became a little difficult to find a job because there are very few centers who could offer me a job. But see, now it is not the situation. Many centers are actually asking for it. So when you hyper specialize to something new, what happens is, initially there wouldn't be a job because people wouldn't understand, right? But over a period of time, when you prove that that area is there, when you prove that that area is required, and many people are having that particular problem, then slowly that area will develop, and if you are one of the initial members who started that, then you'll have a very good run in future. And the next thing would be continuously you need to get trained, because it is more like if you're doing a general medicine or something, then even if you are not updated, you can actually manage somehow. But in all these specialized hyper specialty fields, something new will be coming up every 6 months. You have to keep learning that new technique and keep learning that new method of doing the things, and so you need to be updated. Okay, so at the same time you need to balance between the breadth of the thing and depth of the subject. So you're very much deep in one area, at the same time you can't lose the focus on other areas. For example, if I'm a neuroanesthesiologist, I can't tell that I can't identify a cardiac issue in a patient. It doesn't make sense, right? So even if I'm a neuroanesthesiologist, I'm focused on neuro monitoring. If patient is getting arrhythmia, patient is getting an MI, I should be able to understand that. So you need to have a breadth of knowledge, not very deep breadth of knowledge, and deeply you have to go in one area. So that is how actually you need to hyper specialized. So to conclude, the future of medicine, according to me, would be hyper specialization. I recommend to all my subscribers to take up these base specialties which I told till now, and then venture into specialty, super specialty, and hyper specialize, and tell the world that you are an expert in that particular area. And that is the only way which will work out in future. And the future is niche, and are you ready for that? Is what I'm asking you. Okay. So thank you guys. Thank you very much. And I would like to tell you that my WhatsApp channel is full. That is why I'm not able to take up more people in that. So I think WhatsApp people should understand and increase the number of people whom we can take. So the channel link I'll keep here. You keep trying. If some people exit, you can enter that channel where I actively discuss about opportunities in other Middle Eastern countries, and like how to go to other countries and abroad opportunities. I would like to discuss there. So that's it for today. Hope you understood what I'm trying to tell, and this video might help a lot of people who are going for counseling. So, and good luck guys, good luck for the counseling. Thank you very much.